The staff and service users of Recovery Nottingham, RIN, are pleased to present our 2015-16 quality account.
And I'm really proud to work for the Health Shop because it's a really innovative, creative place to work. So it's the harm reduction service within Recovery in Nottingham, and we provide a wide range of harm reduction services to a diverse range of service users. The staff that work there are very passionate about harm reduction and are very creative in the way that we get harm reduction messages to our service users and with our service users. In terms of what I like about my job, it's a real challenge. It really is a challenge because some of the people we see have had really traumatic lives, and I think to people from the outside seeing the job that we do, which is hand out needles and talk about safer injecting and talk about sometimes some quite difficult stuff, people wonder why you do the job that you do. But it does make such a difference, and there's people that have come here for years and then you won't see them again, and then you'll see them and bump into them in the street and they're healthier and they're active and they're at work and they put weight on, and their eyes, without sounding too cheesy, their eyes sparkle because that same person that stood in front of you, gaunt, who desperately wanted to change but not quite being ready yet to do it, is no longer there. So for us, keeping people alive until they're ready to make a change is what the Health Shop's all about. It's keeping people as safe as possible, be it that give them safer injecting equipment, safer injecting advice, bloodborne virus testing, vaccinations, somewhere to come and talk to somebody. We're a drop-in service, we're there all the time, and we know the client group and we go out and about to people's homes. So, if we can sit with someone until they're ready to make that change, then that's what we're here for.
Well, in the past 13 years, I've been going to the Health Shop. They've been there for all aspects of my life, clean pins, helping me with my family, all sorts. Training, overdose training, CPR training. It's important that it's there. If it wasn't there, I'd think I'd be riddled with HIV by now or some other disease. Now it's open on a Saturday. At one time it wasn't, and if you ain't got no clean pins, then you'd be using the same pin 3 or 4 times, blunt, trying to whack it into your arm or your groin, which is not good. Well, my hopes for the future is hopefully get a job, get clean off everything, drugs, my medication, and my kids.
And the access team is the front door for the whole of RIN, and it's not one front door. We can go to different venues to meet people in the community, whichever's easiest for them. We also have chill out sound support that works specifically with students in the nighttime economy. We do training with nighttime venues and have information in those venues to get early harm reduction advice to people where they're using drugs. So if they are going to use, they're using in as safe a way as possible, but also plant them seeds for change there, and then they know where to come to get help for their drug use. We have a high success rate of the clients we see because we've got those hooks to make them change. They want to keep their relationships going, keep their families together, keep their jobs, keep their homes. So it gives us a good yardstick, if you like, to get people back on track with their lives. What I really like about this role is getting people, making it easy for people to access services, putting an arm round them and guiding them through and starting them on it, not making it feel hard or too clinical for people to access. It's like you're helping a friend, if you like, recover from the drug use, and it's keeping us at the forefront of all the new drugs that are happening, the new ways of working, so we can help people as well as we can, and we know where they're coming from and where they want to be.
Cannabis, for example, just takes over your life. It's just, as soon as you wake up in the morning, you want to smoke. Middle of the day, you want to smoke. Last thing at night, you definitely need a smoke. But for me, it's not the way forward. It just makes you lazy, unmotivated, and it just kills, shatter your dreams. I heard about recovering in Nottingham, gave them a call, spoke to a couple of the mentors there, made an appointment, and yeah, we took it from there. Well, what helped me was the way Neil and a couple of the other guys spoke. They just believe in you, you know, they just help you. They understand where you're coming from, and they can see how deep you want it and how much you want it. And if that's the passion what you go there with, that's the 100% passion they'll give back to you for kicking the habit. For me personally, recovering in Nottingham, they helped me a lot. I'm working now, found myself again. I'm confident, I'm motivated, and I'm just going forward, not looking back, no regrets. But at the moment, I'm just doing some volunteering work for Recovering in Nottingham, helping those who want to do what I did, and just showing that the help's there, and I'll be with them 100% to give them the help they need.
I work for the treatment team in Recovery in Nottingham. We see different clients who are looking to be prescribed medications, various medications for their substance misuse issues and or mental health issues. We're a consultant-led service. I think the expertise of all the workers, you know, the experience that they've all got, and you know, the different backgrounds that we all come from. I'm social work background, but there are psychiatric nurses, general nurses, and people with years of experience of working in substance misuse. So that obviously brings its, you know, that enhances the service greatly. But I think, you know, we work with people no matter where they're at with all the different issues that they bring. I don't know that all services are quite as holistic as that, as well as prescribing. People have told me that I've made a difference to their lives in the past, and I sometimes think, well, what is it then that I've done? Because I've done the same thing with lots of different people, and a lot of the time it's about that person themselves, but you happen to be with them, taking them along and supporting them at a time when they've just got a little bit of extra oomph about what they're doing, and you're there and you're consistent, and you know, you're offering the things at the right time, and you know, if you weren't there, then that wouldn't have happened, I guess. So it's just about being a supporting person to somebody who's making big changes.
I came into the service in 2013 for the fourth time after finding out that I was pregnant. I was addicted to heroin and crack and needed treatment. The midwifery service joined up with the service that I was in, Recovery in Nottingham, and helped and supported me. They collaborated on what I was doing, so they spoke to each other, so they kept each other updated. I was given help and advice, but they've helped and supported me, given me self-belief. And I'm now a proud mum of a 1-year-old son. I'm trained to be a mentor, so I can give back to people what I got from the treatment. Seeing what I've achieved and how far I've come with every milestone that my son goes through, I can see just how far I've come from how it was when I first came to Recovery in Nottingham. Because like I say, I got no stability. I couldn't have brought a child up. So yeah, seeing everything that my son's achieving, seeing how well he's doing, makes me see just how well I've been doing and how much Recovery in Nottingham team has helped, because I would never have been able to be anything like the mum that I am.
Well, I entered the service in Nottingham because I had a heroin addiction back in 2001, around about there. I was using for a few years. The help of the service that I got was unbelievable. I couldn't have done anything without the help and the support that I got from even the slightest things that weren't anything to do with drug misuse, just even personal issues. I felt like I always had someone there to talk to, and that really helped me to cope with everyday life, because it's difficult when you're a drug user. You don't live an everyday life. Everything's revolved around drugs and when you're going to get your next hit. I don't know if it's okay to say I'm living a normal life, because nothing's a normal life, but I've kept down the same job for coming on 11 years now. I had a daughter at the time, but now I've got another daughter. I'm married, I own my own house, I own my own car, go on holidays. I don't think I'd be here today if it wasn't for the support that I got from the treatment centre. The road that I was on was quite a dangerous one. I think I managed to go into treatment at the time, best time possible. Any later, I think I would have been, well, homeless. I would have probably lost my child. I'd probably living rough, and I don't even know. I wouldn't even want to imagine what life would be like if I hadn't have gone through the treatment centre. They've given me the life that I live now.
Really excited about the service that goes off at RIN. We've been working with the service users clients within Aftercare for quite a while now, and what we do is we basically, men and women come in here, get off drugs and alcohol, cannabis, whatever it may be, legalise. We help them introduce them into society, into training, into education. I mean, what we provide really, in all fairness, is a safe environment for these men and women to come to groups before and after. And it's quite fulfilling as a staff member to watch people come from nothing and you know, and building their lives back together, whether that's their children back in their lives, whether that's getting a job. You know, we kind of support and help them with all this. And you know, with Aftercare, it's a long process, a slow, gentle, kind, patient process where we help these individuals slowly interact back with their family, their jobs, and you know, and their well-being, you know, physically, mentally, emotionally, and spiritually. You know, there's a lot of men and women that have, you know, achieved a lot of things coming through Aftercare, and you know, and tapping into what we've got to offer.
I originally came to recovery in Nottingham because I was a heroin addict for 14 years. I basically started when I was at university, when I was in my 20s. And from there, I basically ended up in rehab, which is Studio House, which is based in Nottingham, Basford. A part of the programme with Studio House was that we came to RIN. No matter what problems I have, there's always somebody here that's got a bit of experience or can offer me a little bit of help or support and point me in the right direction. Because even if the services aren't within RIN, they can point you in the services in Nottingham that you can go to. Yes, without RIN, I'll be honest with you, I don't know where I would be today. I use it as the base of my recovery. I come here every day, and I need to come here every day. I access the gym every day. I speak to people internally within RIN, whether they're service users or staff. I have a really close link with the staff here. I find them very useful because most of the staff here have been through what I've been through. They've been in addiction, or they've been in alcoholism, do you know what I mean? They've been through the experiences that I've been through. I can directly relate to them and they can give me advice and experience, and that means a lot for me. I never thought that I'd have the opportunities that I've had, to be honest. I'm just about to start an MVQ in health and social care, and I never thought I'd get the chance to do that. I've been in education before, but I've always been on drugs before, so it's a different experience for me now.
Myself, I'm coming to the end of using RIN Aftercare services, and even though at the end of that it won't be finished, I'll still be able to access their services as and when I feel as though I need their help. So the access is always ongoing. They never close the door on you. They're always there for you, and I just hope long may it continue because it saved my life. I currently work at Sobar. It's a place that's an alternative bar venue where people in recovery can go to and feel unthreatened. The service gave me stability, it gave me self-confidence, self-belief, it helped build my self-esteem, it's helped me to be confident around people who I don't know, able to talk openly about whatever it is I'm feeling. I'm currently at college doing a level 3 professional cookery course, and hoping to achieve from that full-time employment where I'll be able to be a chef and have a life, basically.